Hello, my name is Victoria Jansen, and I'm a physiotherapist working at the Pulvertaft Hand Centre in Derby. I have a particular interest in treating and researching about the problem of thumb-based osteoarthritis, and I've been asked to talk to you about what a therapist can do to help with this condition. I thought I'd start with what we aim to achieve with therapy, and then let you ponder a little if that's covering everything. So we have good evidence to say that therapy can provide pain relief, improved hand use or function, and can improve people's ability to self-manage what is a chronic condition. It hasn't really been researched as to whether that then helps people participate in all the activities that they might want to enjoy in their life, and whether ultimately that leads to a change in disease course. So what do therapists do? How do we achieve for our patients improved hand use and reduced pain? Well, our core treatments are education and exercise, and these are treatments that are advocated by the NICE guidelines, the National Institute of Clinical Excellence. Until recently, I'd probably also have added hand splints to that group of treatments. But the Otter trial has shown us that if you provide a comprehensive package of education and progressive exercises, that adding a splint to that treatment doesn't improve outcomes further. So when we think about treatments for this condition, our core treatments of education and exercise should be provided to everybody. But then for those who don't respond to those treatments, we can use a step care approach where we add in other treatments, and splints would now sort of fall into that group really. So that if you didn't respond, you could have a splint, and if you still needed more support, then a steroid injection. And finally, for some, surgery is required to settle pain. As therapists, we treat, I do apologise, my slides are wanting to skip. As therapists, we, as part of our education, we cover lots of topics. So I just wanted to sort of touch on what we cover so you could understand it a little bit more. So we educate people about those treatment options that I've just discussed, about the thumb structure and its anatomy and the changes that occur with osteoarthritis. And you can see an X-ray picture there just showing you that the joint spaces become a bit more narrow between the bones where there's been cartilage lost. And you can see that that thumb is sitting in a very tucked in close to the other, the palm really, position. And that's shown in the picture below as well. We teach people about how certain postures tend to overload the thumb and may over time lead to those deformities that we can see in that X-ray and in that hand below it, where the thumb seems to lose the ability to span out wide to grasp. And you can see that the picture of the person opening the jam jar on the top right, or the Ovaltine jar, is putting a lot of strain through the hand. It's exactly mimicking that posture of the thumb being tight into the palm, and it tends to load that basal joint more strongly. Concepts in joint protection are about how to use your joints in more healthy postures. And so a more healthy posture is given in the example below, where somebody is taking the load through the palm of the hand and using their forearm and their shoulder to exert some of the turning force rather than the tips of the fingers and thumb. So what's important as therapists is that we talk through an individual's particular issues, because everybody's lifestyles and hobbies are different, and we try to look at what particular tasks they do in their everyday life, that tend to aggravate, and then make our advice really specific so that it's easy for them then to implement and use in life. And sometimes that requires that people have particular aids and equipment to help them. And you can see some examples there of things to help turning keys or spring release scissors that are easier to use. But in therapy, we can often also provide people with the opportunity to test out different gadgets so that they can determine if something would be helpful to them before they choose to go and then perhaps purchase things to help. We also talk in therapy about ways to manage pain, using heat or ice or topical anti-inflammatories can be really good ways to help self-manage pain. And also talk about managing fatigue and pacing activities as well. What do we cover in exercise? So a therapist would assess an individual and design an exercise program that's tailored to their needs. But the principles perhaps of what we're trying to achieve are similar, and the aims will be to stretch out tight muscles, to use range of motion exercises to ease stiffness where it's present, or to maintain motion and prevent stiffness. Exercises are taught to help improve the control of healthy postures so that someone will more automatically use their hand in those more healthy postures, and to improve strength so that somebody has the endurance and the power they need to do the tasks that they need to do each day. We've mentioned that for some, splints may be required, and these can be tailor-made, such as the splint on the right, that's made out of a rigid thermoplastic material, or they can be splints that are used from prefabricated, that are pre-made, and then we just fit them. There are an enormous different variety of splints in all sorts of materials, and also in terms of how many joints they support or restrict. And really what's essential about a splint is that it's relevant and helpful to that person. So for example, if you had a rigid splint there that does prevent movement and ensures rest, it might also get in the way if you had to do something like use a walking stick to walk with, so it wouldn't be particularly helpful for somebody with those needs. But splints also provide people with warmth, which is a helpful pain reliever, and a reminder to take care of their hand as well. So they have many different functions, but what's key is that they're well-fitting, don't rub or dig in, and that they are useful to that person in their lifestyle. So we aim by the end of therapy treatment, and someone might have one session or they might have up to 6 sessions, but that person understands their condition and how they can avoid having painful flare-ups, which do happen, but also settle any flares that they have, so that they return to a state of painless osteoarthritis. And we aim to teach them how to keep their thumbs as strong and as healthy as possible. These do require that patients are motivated and willing to make changes in their habits and to incorporate exercise into their daily routine. So I hope that helps you understand a little bit more about what therapy treatment can offer to patients with osteoarthritis. Thank you for listening.